Next, we have Dr. Vikram Venkateswaran, founder of Healthcare India, presenting Role of AI and ML in Preventive Health.
So, thank you all for the warm introduction. And we live in very interesting times these days because, with regards to the usage of artificial intelligence and machine learning across industries, has been significantly high. You know, when I talk to healthcare leaders or industry leaders, we find that the novel coronavirus and the pandemic has done much more for digital transformation overall and the adoption of artificial intelligence and machine learning across industries. And in healthcare, the increase has been tremendous. As a matter of fact, last couple of years, a lot of focus has been on the adoption of cloud, which is a good foundational way to start with your machine learning and artificial intelligence strategies. But today I'm going to talk about some of the areas where AI and ML have been used in preventive health. So, like the presenter announced, this is some things about me. If you want to get in touch with me, Twitter would be a good place, or I'm on LinkedIn as well. So, let me take you back to an incident that happened with me a couple of weeks ago. In the morning, I was trying to uh, go for my morning jog, and interestingly, one of my neighbors, who's a senior citizen, she had collapsed right outside our walking area, and there was a bunch of very worried neighbors who were trying to revive her. Now, interestingly, when I arrived at the scene, and being a doctor, they said, "Okay, can you see what's going on?" I realized that the patient herself was in no position to respond to any of the queries. But interestingly, also, her family members had no idea about her medical conditions. What are her parameters? Was she diabetic? Was she hypertensive? What medication was she on? So it was very difficult to ascertain anything, and there were no written records for her. Interestingly, all around, people wanted to help, but nobody was really trained on executing or implementing emergency procedures. It's a very sad state of affairs that we know so much about so many things through the internet, but we know very little about crucial things like emergency care that can really help to save someone's life. Luckily for them, unfortunately for me, I was there by chance. I was not even planning to go that direction. Stabilized the patient, gave her some ORS, realized that she might have fainted due to exhaustion. We called for an ambulance immediately, and despite the heavy Bangalore traffic, the ambulance arrived miraculously in about 10 minutes. We I quickly briefed the nurse on the ambulance, and we, you know, uh, got the patient into the ambulance with her family members and packed her off to the hospital. But later, while recounting from others who were there in the scene earlier than me, we had wasted about 25 to 30 minutes. That really worried me. When you look at a healthcare situation like this, the initial 25 to 30 minutes is very important. And somehow, due to the lack of knowledge, lack of awareness, lack of experience, we had wasted that time. I believe that artificial intelligence and machine learning can really help us in this area. And I'm going to elaborate why. It's very important for us to not only know what to do, but also have some guidance on it. And this is where I think AI and ML can play a big role. So we're doing a survey, some research on health information and how people react to health information. And it's still in preliminary stages, but one of the interesting insights I got is of the number of people we spoke to and we polled, almost 85% look for health information online, which is fantastic. Now, this is in line with a lot of surveys that have been done abroad, countries like Finland, Sweden, which are much ahead on the information curve, also countries like the US and Europe, which do spend a lot of money on healthcare. The parameters are pretty much same. Almost, 70 to 80% of people do look for information online, health information online. So in case you have a cold or you have cough, you try to look for differential diagnosis. In COVID, because of the various situations we went through in the various phases, the online search for information has greatly increased. But interestingly, right about only 50% of those who said, yeah, we do look for health information, but only 50% were very comfortable using that information to make decisions. What I experienced with my neighbor a few days ago was pretty much in line with what I'm seeing here today, that very few people are able to use all that information to make decisions, whether it's regarding their health or somebody else's health. Now, this is a big gap area. Earlier, the gap was information and knowledge. Today, our gap is application of that information or knowledge to take decisions or to create processes. And this is where I feel is the biggest area where technology, especially AI and ML, can help. Where I feed in some information, the system looks at all the necessary information available, all the practices, the prognosis, decisions taken, medicines, and parameters, and give me a set of processes that I can follow. About 5 years ago, I had visited a hospital in Bangalore, and they were demonstrating a new uh, defibrillator. A defibrillator is something that you give to a patient when he collapses due to a cardiac arrest. And what was interesting about this defibrillator, which I think was produced by Philips, was that it came with a set of instructions of what to do. How do you remove the package from the system? How do you apply it? What are the buttons you need to press? Where do you need to apply it, etc. And I think most airports today, if you look very closely, there will be a red defibrillator available to you, called AEDs. Now, that I think is the starting step of using AI and machine learning to, to do preventive health, right? Though in that case, it's an emergency intervention, but I think those are the directions in which we are going. So, what is happening in the healthcare system, and why is AI and ML so important today? Like I said, data for the last couple of years shows us that the cloud adoption in healthcare has gone up tremendously. Today, we see, for example, in life sciences, which is a good parameter, cloud adoption is as high as 80% now. And this primarily because of COVID, the necessity to make the business work despite the distances has increased the cloud adoption. And today, you see a lot of R&D activity also happening on cloud. Also, the consumer requirements have changed a lot. Today, people expect better services. They expect better treatment. Yesterday, I was in a panel discussion with some of the eminent thinkers in healthcare from Asia Pac, and we had a couple of doctors and a research scientist from Singapore. And they started comparing how a healthcare system needs to be, and they tried to extrapolate it to Amazon, how Amazon works and how the healthcare system should work. So imagine being benchmarked against an e-commerce site for the use of healthcare. And that's what we're heading towards. So our consumer demands, our expectations, our experiences are changing tremendously. And today they expect and appreciate new care delivery models. So I don't need to go to the hospital to get something done. Today I can, through telemedicine, interact with patients, talk to patients, uh, you know, give them diagnosis in certain conditions. So that is the model in which we are approaching. Obviously, all this has to be maintained within a regulatory framework, compliance framework. In case of healthcare, there are strict regulations that govern from Ministry of Health and Family Welfare. We also have the IT Act that governs a lot of it. But despite the growth in digital, the regulatory requirements have also grown along with it, and we should see more regulations come into this space in the next couple of months. A lot of organizations are continuing to invest in digital innovation and transformation, and that too, they are looking at areas like patient experience, patient convenience, uh, collaboration between various research organizations to improve care outcomes. And last but not the least, there's a huge war for talent. Healthcare is no different. So recruiting, developing, retaining the best talent, the best doctors, the best nurses, the best paraclinical staff, the best radiologists still continues. All these trends are pushing us in a direction in which healthcare will be more data centric, will be more technology centric, and will be more built on patient experience. And all this points towards a growth in artificial intelligence and machine learning adoption. So, what is happening in AI? Let's look at some of the growth parameters across healthcare, right? On my right are some of the technologies that are really improving things in healthcare. AI and machine learning are on top, and we're going to discuss that today. But there are other areas like Internet of Things, drones, automation, 3D modeling, your immersive technologies like metaverse and blockchain. On the left are some of the investments being made. For example, the preclinical drug discovery industry has been given a big boost by AI. Almost 1 billion investments have gone into this space. If today we are able to do peer review and do a preclinical research based search on various clinical parameters, molecules, toxicity, and efficacy data, it's because of AI. Almost $4.5 billion be spent by the pharmaceutical industry itself on digital transformation. Now, this is very significant because, like I said, a lot of growth in the last couple of years has been on cloud. And today, the era of AI is here. Now, almost 85% of the patients we surveyed that I discussed with you felt that they could take care of their health with access to online resources. Interestingly, the difference between knowing what to do and actually implementing it seems to be a gap, and this is where AI can really help. Also, there's a 20% increase in the growth of cloud computing in pharma. I think the numbers are similar for healthcare. So you see, there is a clear pattern now in which a lot of organizations have started implementing AI and machine learning, and the end objective is to improve care outcomes. This is another very interesting experiment that we did a few months ago, where we used an AI-based system to track sleep patterns. What we did was, we fixed a sensor, which is available in most of the wearable devices or even in your smartphone. And through the sensor, we tried to analyze what is your sleep and how you are sleeping, whether the sleep is improved or not improved, and then correlated that data against overall disease conditions or your wellness index. Now, there is another startup in India, which is, I think, Delhi based, which it's called Fingerfits. That's a similar activity with WhatsApp, which is very fascinating how they, build this nudges to help you with your better sleep, better medication, or better habit reversal. And every day a message comes to you where you're asked to rate your sleep activity or nudge you towards taking your medicine or doing an exercise that you're not doing. Now, though these are initial stages and it is very conversational AI based, I think this can be further integrated with your longitudinal health data to actually customize the nudges for you and make very realistic and tactical interventions. This project is also in these initial phases, and we are now starting to look at the implications of doing this, especially with areas like senior citizen and chronic care. If I look at the way Gartner has looked at artificial intelligence, and this is a typical Gartner hype cycle, and this is of July last year, but it gives you a pretty good experience as to what is happening in the healthcare space. Uh, Semantic search, computer vision, chatbots, they have pretty much reached a level where mainstream activity is going to start taking it up. But your artificial intelligence, machine learning, they are still on a curve. I think we are nowhere close to the total implications of these. While things like your composite AI orchestration, model ops, AI governance, we are still in a very, very, very initial stages. And we are nowhere close to artificial general intelligence. Most of our AI, artificial intelligence models are narrow use AI. That means for a particular area that AI can be used, but the AI does not have consciousness and it can't take general decisions. So as far as AI, general AI is concerned, we are still way off. But it helps you appreciate where we are right now. I think conversational AI or chatbots, I just mentioned here, I think they're going to get mainstream. Just like semantic search, which has also gone mainstream, I think we'll see a lot more usage of conversational AI in various applications in healthcare, including diagnosis. If that patient who I was referring to in the beginning of my session had access to a medically enabled conversational AI, we would have had a very different outcome where we would have probably made a decision very quickly to call an ambulance. Unfortunately, no such system was available. At the same time, we also see the implications that we lost about 25 minutes of our time in trying to decide what is to be done. And hence, the areas where a lot of healthcare institutions, as well as patients and patient parties, would invest in going forward is AI that can tell you the actual information as to what will really help you. While this is happening, we also see a lot more investments being poured into this area. And we'll look at some of the investments from a healthcare perspective much more closer. So there is a lot of activity at the care provider stage that is being tracked through artificial intelligence and machine learning. Some of the key parameters in artificial intelligence, uh, some of the key parameters being tracked by artificial intelligence for a hospital include your normal KPIs, including length of stay. What is the average length of stay of an individual for a particular condition? What is the readmission rate? What kind of patients get readmitted? Can we prevent readmission? Can we make proactive interventions that will stop the hospital, the patient from getting a readmission for the same condition? How many emergency admissions do we have? Could we have avoided those? You can't avoid things like roadside accidents or other household accidents. But can we take a notice of all these things that are happening, and can we devise strategies for individuals or patients to avoid emergency admissions? Like what happened if the lady was in emergency admission? Could we have administered, intervened the day before? It seems the day before that particular patient you requested in the beginning of the session, she had gone for shopping, she had walked through a lot of areas, it was slightly hot the previous day. Could we have avoided all that? AI also looks at workflow in the hospital. For example, departments like radiology and pharmacy, which always end up as bottlenecks. Could we have done better? Can we devise a process better to improve the patient experience? Now, idea is to overall clinically improve operations, obviously, bring in operational efficiency, but also get in better patient engagement. A lot of hospitals have started working in this area, and it's tremendous how a lot of this would lead to preventive care in healthcare. The second case is of a hospital in Bangalore. Actually, it's a national chain, one of the largest hospitals in India, Manipal Hospital, that started working with an artificial intelligence system called Watson. And Watson is a system from IBM. And they found out that when they did an analysis of the recommendations given by the Manipal oncologist versus what was given by Watson, especially in stage 1 and stage 2 cancer, the concordance, that is, the agreement between the two, was as high as 90%. This is a phenomenal achievement. I know AI is still in very preliminary stages, and if you go back to remember the hype cycle, we are still probably in the beginning. But the very fact that the concordance seems so high between the two gives us a great sense of indication that we are on the right track. And if AI can help us really make those decisions, I think it'll really help us decide what is it that we can do to help the growth of diagnosis, which is machine aided. Just for all the doctors who are probably listening to me right now, what I mean is, I'm not saying that we will replace doctors. That's not possible. Even the law does not say we will replace doctors, because legally, every prescription has to be signed by a doctor who has registration with the Medical Council of India or the state medical health associations. But the amount of decision support that can be given by a system, by an AI system, can really help us prevent a lot of hospitalization, prevent a lot of seriousness, and help improve care outcomes. That's all I'm trying to say. So, what are the implications for India as far as AI is concerned, especially in the area of using artificial intelligence and data? Number one, if you look at Ayushman Bharat Yojana, and if you want to read more about it, I've written about it in my website, Healthcare India. Ayushman Bharat is probably the first demand side healthcare intervention that we have created. And it provides insurance to more than 10 crore people below poverty line and their families. About 50 crore people are affected, and they have about 5 lakhs of insurance per family per year. What this will create is a lot of data, and already I think more than 31 million procedures have been performed under Ayushman Bharat. The ton of data that is being produced under this is a good feeder into our machine learning programs. This is just the beginning. I know there are much more happening, and there's integration of about 150,000 wellness centers along with it. The second area is self-help bots. We talk a lot about how self-diagnosis mechanism could have helped the lady that day. But I know Apollo is working with Google, for example, to create a self-diagnosis bot that works on machine learning. So you give a set of parameters, you give certain conditions and your physical state, and it will tell you a set of diagnosis that is important for you. Also, I do see a lot of implications of platforms like DeepMind, which is a Google platform, which is a cognitive platform for diagnosis. And last but not the least, there is the disease surveillance program that is running in the country, but also we are running a pilot on digital disease surveillance where we look at a lot of data that is publicly available from digital platforms and seeing how we can track certain disease conditions. I think the future of healthcare in India is heavily going to be driven by data. And now, with telemedicine being legal and acceptable, and a lot of hospitals and medical institutions investing in healthcare, especially on the data side, I see a tremendous growth in the way we will look at care.
So while all this is great and machine learning and AI has huge implications for healthcare, there are also certain areas that we need to be more concerned about. Number one, I think overall, any unauthorized access to patient data is not acceptable. And this is a big risk to those undergoing the treatment and also has implications from a regulatory perspective to the organization, right? Number two, machine learning models often tend to learn from mistakes. That means initially there have to be strict controls set in case the diagnosis is going slightly wrong. It's not always that Google Maps sends you on the right route. Similarly, it's not always possible that the AI system, the machine learning system, will give you the correct diagnosis. Sometimes they will give an alternate diagnosis just to see what are the implications of it. So a lot of controls have to be put in place to ensure that when such a diagnosis is given, it is either corroborated by a clinician or is it overruled in case it's not effective. A lot of internal process controls have to be set up. For example, in case of supply chain for cold storage of vital medicines, biologics, vaccines is a great example where if it's not stored at the right temperature, can prove ineffective. There is also this challenge that a lot of organizations work with third party tools, third party platforms, cloud providers, etc. So you need to have the right checks and balances to make sure that no unauthorized entry or mistakes are happening from your third party system. That means whatever you're doing internally have to be extended to your extended enterprise as well. Comprehensive data tracking has to be done. India is going to soon, clear the decks for the data privacy bill. A lot of implications of that will impact healthcare. You need to make sure that data privacy is paramount. Also, you need to monitor these resources continuously because cybersecurity continues to be a great challenge, a great threat to India. So we need to make sure that the processes and the systems are continuously monitored for unauthorized access as well as any vulnerabilities that might happen. While AI has the potential to do a lot of things, without the right checks and balances, it can go all wrong, and that will lead to further issues, especially curtailing of AI programs. Remember, this is not like a wrong decision support in a retail program where you maybe bought the wrong size T-shirt or the wrong color. This will be dealing with people's lives, so there will be implications on it. So, what are the key summaries and takeaways from this session? A, AI is here to stay. The sooner we align with it, the better it is. It is not going away. It is not something that will affect financial services or retail or just media. It will impact healthcare. AI has the ability to improve care and patient outcomes. That's given. All healthcare organizations are aware of it, and they are taking measures. A lot of startups have come in this area, and they are making huge strides in the implications and addition of AI and machine learning into their systems. AI was a big tool that helped us in developing vaccines in record time. For example, almost 9 to 12 months we had vaccines for COVID. A lot of that came because AI was used in R&D, and obviously there were a lot of emergency use mechanisms that were used to bypass and to fast track regulatory clearances. But AI was very helpful in not only looking at a lot of literature that was already out there, but helping in the R&D process. There's a lot of business transformation happening. Patients and consumers alike are expecting better services, experiences from the healthcare providers, and AI will be a big source of that. Last but not the least, those who implement AI will have a competitive advantage. They will be able to move faster, better, more efficiently. So if you're not doing that, it's a big detriment to you. With that, I would once again thank you for your time today.